Hello and welcome. Today we're diving deep into a complex but vital topic: hyperoxaluria. This condition affects the urinary system, and understanding it is crucial for both patients and healthcare professionals. We'll explore what it is, why it happens, how it's diagnosed, and the available treatment options. Hyperoxaluria at its core is a condition where there's too much oxalate in your urine. But what causes this excess oxalate? Several factors can contribute. Primary hyperoxaluria is a rare genetic disorder where defects in liver enzymes lead to overproduction of oxalate. Secondary hyperoxaluria, on the other hand, arises from other conditions. These can include high oxalate intake through diet, intestinal disorders affecting oxalate absorption like Crohn's disease or short bowel syndrome, or even prolonged use of certain medications like high doses of vitamin C. Now let's understand how hyperoxaluria impacts the body. Oxalate, when present in excess, combines with calcium in the kidneys to form calcium oxalate crystals. These crystals can accumulate, leading to kidney stones. Over time, these stones can cause blockages, damaging the kidneys and leading to kidney failure. The accumulation of oxalate crystals isn't limited to the kidneys. In advanced cases, they can deposit in other organs and tissues, a condition called oxalosis, causing widespread damage. Hyperoxaluria, particularly the primary form, is considered a rare disease. Primary hyperoxaluria affects an estimated 1 to 3 individuals per million worldwide. Secondary hyperoxaluria is more common, but its exact prevalence is hard to determine since it's linked to various underlying conditions. It is important to note that hyperoxaluria can occur in any population. However, certain genetic mutations causing primary hyperoxaluria may be more prevalent in specific geographic regions or ethnic groups. The symptoms of hyperoxaluria can vary depending on the severity and the presence of kidney stones or oxalosis. Common symptoms include recurrent kidney stones, blood in the urine, and pain in the back or abdomen. In advanced stages, symptoms of kidney failure may appear, such as fatigue, swelling, and decreased urine output. In cases of oxalosis, patients might experience bone pain, anemia, skin ulcers, eye problems, and heart issues. Diagnosing hyperoxaluria involves a combination of methods. Urine tests are crucial to measure oxalate levels. Blood tests help assess kidney function and identify any underlying metabolic disorders. Genetic testing can confirm primary hyperoxaluria by identifying specific gene mutations. Kidney stone analysis determines the composition of stones, usually calcium oxalate. In some cases, a kidney biopsy may be necessary to examine tissue for oxalate crystal deposits. While the general term is hyperoxaluria, understanding the specific type is critical. Primary hyperoxaluria has 3 main types. Type 1, the most common, results from a deficiency in the AGXT enzyme. Type 2 arises from a deficiency in the GRHPR enzyme, and Type 3 is linked to mutations in the HAGA1 gene. Secondary hyperoxaluria, as we discussed, doesn't stem from genetic defects but rather from dietary factors, intestinal disorders, or medication use. Treatment for hyperoxaluria aims to reduce oxalate production and prevent kidney damage. For primary hyperoxaluria, treatments may include high fluid intake, medications like pyridoxines of vitamin B6 to reduce oxalate production, and phosphate and citrate supplementation to inhibit calcium oxalate crystal formation. In severe cases, kidney transplantation or liver transplantation for primary hyperoxaluria may be necessary. For secondary hyperoxaluria, addressing the underlying cause, such as dietary modifications or treating intestinal disorders, is key. Dialysis may be needed to manage kidney failure. Preventing hyperoxaluria, especially secondary hyperoxaluria, involves several lifestyle modifications. These include maintaining a balanced diet with moderate oxalate intake, staying well hydrated, and managing underlying conditions that contribute to increased oxalate absorption. If you're at risk, consulting a registered dietitian for personalized dietary advice is highly recommended. The prognosis for hyperoxaluria varies depending on the severity of the disease and the timeliness of diagnosis and treatment. Early diagnosis and treatment can significantly improve outcomes and prevent kidney damage. Primary hyperoxaluria can lead to end-stage renal disease in childhood or early adulthood if left untreated. Recent research is focused on developing new therapies, including gene therapy and RNA interference, to target the underlying genetic defects in primary hyperoxaluria. Furthermore, researchers are exploring ways to improve oxalate absorption in the gut to reduce its excretion in the urine.